Hi, I'm here with SarahLyn McConaughey, and she is a graduate of the Breathing Deeply Yoga Therapy Advanced Program. She's a C-IAYT, and we're here today to talk about a client she worked with so we can get a feel for how she works and how yoga therapy might be beneficial. So thanks for being here, Sarah.
Thank you.
So why don't you tell us who this person is and what they came in, what their complaint was when they found you?
I worked with a 43-year-old lady who had low back pain for over 10 years. She also had autoimmune issues that we worked a little bit with as well. And she hiked a lot and did a lot of physical activity and had daily pain in her low back when she would go to bend over to do any tasks.
Had she been to other people in these 10 years? What had she done to help herself? Anything?
She did a lot of massage therapy. I'm
Hmm.
not sure if she did anything besides that.
So you didn't have a diagnosis from a doctor or anything like that. She didn't
It's
know what was
just
wrong with her.
this nagging pain for over 10 years
Mhm.
that she just lived with.
Okay, so you took a look at her and you evaluated her. What did you give her to start?
After we did the muscle testing, we went ahead and I did the poses that were going to strengthen the glutes.
Mhm.
For her, it seemed as though the low back was taking over the glute to create a trigger point back there and some pain. And so we did a lot of like yoga poses that would strengthen those glutes for her,
Mhm.
glute medius, especially. And then we did some therapy ball trigger point work as well for about once a week. And the daily practice was the strengthening.
How long did the daily practice take her? Like,
Oh, maybe 20 minutes.
okay, so she was compliant, like she could
She
do
was
that
compliant every day for 20 minutes.
every day. Okay. Wow.
Yeah.
Okay, great. And so she does her homework.
Yes.
All right, go on then. What happens?
After about 4 months of daily strengthening, she got rid of that trigger point in her low back, and the pain was significantly reduced. After about 6 months of daily strengthening, she was able to do 3 to 4 hours of strenuous landscaping for about a week after she had bought a house. Each night she would stop when she would start to feel the pain. So that was also really good with the yoga therapy, is starting to listen to her body and notice and stop. And then she would be fine to go for another 3 to 4 hours the next day. And she had said if she had tried to do that at the beginning of the summer before we started working together, she wouldn't have been able to do that.
So what was the kind of interested? So you did glute strengthening, but she has 20 minutes, so she clearly did some other things in her yoga practice, right? Like so what did it actually look like just for people listening? Like what was she doing on the mat?
Like some bird dogs, some fire hydrants, some chair.
So a lot of stuff directly at her hips and glutes. You just really a lot of strength work and
Yeah,
you just targeted it there thinking this is definitely the problem. And it turned
yeah,
out it was the problem.
it absolutely was.
Yeah, that makes sense. I've also worked with a lot of people like that where you can just see that there's a muscle group or two that are very weak, and if we strengthen them up, it's going to be okay. And it sounds like you were able to teach it to her in a way that allowed her to like notice sensations earlier, because you said she stopped and she wasn't able to do that before. What aspect of the practice did that for her? Were you teaching her with breath, or were you?
We did do breath work, awareness, like going into it, lower belly breathing, and just maybe some anxiety components. But we also were doing yoga nidra as well for the autoimmune stuff.
So she came with you with two conditions. You were just telling us about her back because that's what we're doing right now. But she was also doing a meditative practice, which was kind of changing how her mind perceived things.
Yeah,
I see. So you think that in combination. Do you think you would have gotten to a meditative type practice if she didn't have another condition, or were you kind of lucky, from the
I was
beginning?
lucky in that.
I guess you might have gotten there later, but
Yeah.
you did it right from the beginning. So she was able to sort of moderate her movements. So basically, in summary, you get a client, they have back pain for 10 years. In 4 weeks, you see improvement. And then in 6 months, she can do the things she wants to do without a
Yeah.
big problem. Does she have any pain now? Like, how did you end it?
No, we actually worked together for 9 months, actually. And at the end of 9 months, she was able to do, she also does scuba diving, and that always created low back pain. And she was able to teach for a month straight every day in a scuba setting, either in a pool or the ocean, in those postures that would normally hurt her with no pain. No pain.
Right. So you got her to no pain in 9 months, to
Yeah.
zero pain. And just for everyone listening, when you hear 9 months, you might think like, oh, that's long, but we're not seeing people all the time. Like you wouldn't have,
I
if it was
saw her
just
about
for
once a month.
once a month, and that was for two things.
Yeah.
So you were helping her with multiple things. So did you see her 9 times or so through the whole?
Actually, I saw her, yeah.
Yeah.
And then a little bit more after that because we started working on pelvic floor stuff as well.
So 9 sessions over a course of time. Problem solved. On to the
Mhm.
next problem.
Yeah.
Well, it sounds like that turned out amazing for her, and it must have been really a nice experience for you to
Yeah.
see your client improve like that. Was she happy with the results in the end?
Oh, yeah. After, especially after this scuba diving month session, she was very shocked.
Awesome. Awesome. I'll just say it's one of those things where often when we have chronic pain, we feel like it's not solvable because it's been so long. So I just feel like this is a good example, right, of someone who was smart enough or lucky enough or something to come to you and like actually give it a go after 10 years, but pretty impressive to solve a 10-year problem in a 9-month period. So that's amazing. So good for you. You live in Alaska, but where do you live in Alaska exactly?
Touch can?
What she said, that word. And if you're near her, you probably know that word, but I do not know that word.
Southeast Alaska.
Southeast Alaska. You can find her there. And there'll be links on our website as well if you want to find her virtually. Sarah's an excellent yoga therapist and a lovely person. So thanks for sharing that with us, Sarah. I appreciate it.